Well, breast cancer is one of the most common cancers for Australian women, but early diagnosis has been disrupted by COVID and it's still not back on track. Around 1 in 7 women are diagnosed with breast cancer in their lifetime, but too many are delaying breast screening. Joining me now live is leading breast cancer surgeon, Dr. Sanjay Warrier. Thank you so much for joining us today, Doctor, to speak about this. What are you finding? Are you finding that women are still delaying having a screen?
Yeah, so thanks for having me, Danica. We're still seeing advanced cancers coming through, and that generally reflects the fact that our patients that we may have been seeing prior to COVID not presenting regularly before having symptoms, they're now potentially presenting when they have symptoms, and it ultimately leads to us having to do potentially more treatments than we need to for those patients. So we are definitely seeing a higher group of advanced cancers.
And I guess what issues does that cause then when you've got such a backlog and they're coming in with a different stage of cancer? What does that mean?
Yeah, so like if we can find a cancer when it's screen detected, meaning that the patient doesn't have a symptom, it ultimately means that we're treating a cancer which is potentially smaller. It hasn't found its way to other parts of the body, such as the lymph nodes. And as a result of that, the treatments we might be offering that patient may be less. And ultimately, if a patient's presenting with a larger, or when they have symptoms, ultimately the types of treatments may be increased, and therefore their treatments end up being longer, and it puts potential pressures as well.
What's behind the delays? Is it a simple case of women forgetting?
I think it is probably a mixture of things. Like one of the factors would be routine prior to COVID, and then getting back in the habit of actually doing the regular screening. Part of it is when you're looking at a cohort such as women, they may have 3 kids at home, they're doing homework for the kids, they're prioritising other things, and then having the time to potentially prioritise themselves and do their basic breast health checks. It's important, but they're also looking after often they're the nucleus of a family. So it puts a lot of pressure on them to potentially think about themselves as on top of other people, essentially. Yeah. So that's probably one of the things that we see.
Yeah, absolutely. Yeah. And it's just so important to raise awareness to get out there and have this important screen.
Yeah.
From your perspective then, how critical is early diagnosis for you to be able to treat somebody?
I think to put it out there, we've got fantastic treatments for breast cancer, and we always want to do better. And one of the key ways that we can do better is by diagnosing cancers earlier. We still know that the biggest thing that makes a difference in terms of outcome is if we can find something before it enters the lymph nodes. And we get good outcomes when they are in the lymph nodes as well, but if we can find them earlier, we can definitely treat them. And it often involves a small operation and potentially other treatments such as radiation, and also potentially hormone tablets or chemotherapy.
How frequently should you be having a breast scan?
Yeah, so from our recommendations through BreastScreen, which is a publicly funded system, is from 40. There's an option for women to go to screening every 2 years, and it's strongly recommended from 50 to 74 every 2 years. And the idea is there's still that option between 40 and 50 to have that free health check.
So do you recommend then women over 40 to get the scan, or what age should you start?
I think definitely from a scan perspective in a screening program, and we should be doing it from 40 this is our independent sort of perspective on it. You're never young enough to start that process of being proactive with your health. And then when I talk about cancers generally, there's 10% of cancers that happen before 40 as well. So we are not uncommonly seeing patients between 30 and 40 who have breast cancers. We have seen them in their 20s as well. So if you have a symptom, I think it's very important to separate screening and somebody who actually has a symptom. And if you have a symptom, the best way to approach it is to see a general practitioner or a health professional, get it checked out. And that includes lumps in the breast, that includes discharge or changes in colour. And then on the back of that, They'll be able to guide you if there's a lump. Often that involves an ultrasound and a mammogram, which is an X-ray, and then potentially a biopsy of it.
So essentially, women can just self-check before they go to a GP.
As well, like I think that's an important point, and having an idea of what your breasts feel like is an important way to understand changes in it. And there are varying thoughts on how often to do it. I'm generally recommending at the start of each change of season, so 4 times a year minimum. And the way that we educate our patients to do it is to do a simple look, lift, feel. So looking in the mirror, looking for skin changes, then lifting the arm above the head, and then feeling systematically through the whole breast. The systems we use for feeling the breast vary, but as long as you cover the whole breast and include the nipple and include a little bit of tissue underneath the arm, which we call the axillary tail as well.
Some really good, very good advice there, and very simple to do, obviously, as well. What about if a woman has got breast implants? Does cancer still apply to them?
Absolutely. I think there are 2 aspects with that. With breast implants, there's the fact that, like you said at the beginning, Danica, they're still at the risk of 1 in 7, meaning if they have 6 friends in a room, you have potentially a risk of one of them through their lifetime developing breast cancer. So it's still very important for them to be screened regularly and no differently to someone who doesn't have implants. And then on top of that, there's a very low risk of certain implants developing a type of lymphoma after chronic inflammation. So there are important aspects to checking the implants, but there are also really important aspects to not forgetting about your breast health if you have implants.
Yeah, very good reminder as well. What would be your message today?
I think the key message from today, if everyone can just think about, are they up to date about their screening? I'm a breast surgeon. Our focus is the breast, but that includes colorectal, it includes prostate for males. I think if we can pick things up before we have symptoms, then the health professionals can potentially treat things which are smaller. And as a whole, as a community, we're getting less advanced cancers. And it's one of the great things with Australia that we have a screening program that is effective. And when we compare with third world countries that don't have it, the types of general cancers they're generally seeing tend to be a more advanced, different biology type of cancer. So the messaging today is please be proactive with your health and, get that done and then get on with your lives.
Yeah, a great message, and it's so important, as we said earlier, 1 in 7 women likely to be diagnosed. So it's a frightening statistic. Dr. Sanjay Warrier, appreciate your time. Thank you so much for joining us today.
Thanks, Danica.